A surgical procedure in one of the most modern operating rooms in Germany, found in Leipzig. The technologies that are used here are by no means standard. But how much high-tech do doctors need during surgery? What new technologies can support them better, both prior to and during surgery? Using intelligent software, the Innovation Center Computer-Assisted Surgery at the University of Leipzig is developing answers to these questions. Computer scientists and engineers work closely with physicians. 4 research groups are working on process models for surgical procedures, digital patient models, and new imaging techniques for surgery. In order to allow the surgeon to concentrate on the essentials during the procedure, the Model-Based Automation and Integration Working Group has developed various technologies that they have tested in their unique demonstration operating room. They are also testing the Process Navigator. Similar to reading a map, the surgeon can see which steps have already been completed and which are still to be done. We want to use technology to support the surgeon as much as possible, so that he can concentrate on his core activity, the treatment of patients, and not on the secondary activities. Those are handled by the technology. This includes the magic lens the doctors may test here. A tablet computer is passed over the patient, and the appropriate anatomical images of their insides can be seen. This is especially useful for difficult, minimally invasive procedures. Cameras and special software make this possible. The specially outfitted demonstration operating room enables us to work with computer scientists to develop new things here for the first time, to do dry runs and correct errors, before we go into a clinical trial in the real operating room with the patient. It is just as important to find the best treatment for the patient before surgery as it is to have technical support during the operation. The surgeon in the operating room does get help from assistance systems like navigation, but this is not as important as the support he gets in order to make the right decision, because of the wealth of data that we collect from each individual patient. That's why some of ICCAS's innovations are already a clinical reality. For example, here, at the weekly meeting of the Tumor Board at the Leipzig University Hospital. With the help of the software system OncoFlow, all the available information about a patient can be called up. This allows for a more accurate planning of surgery. IT specialists are also part of the Tumor Board. They are developing a digital model of the patient in the context of ICCAS. It is a unique, virtual model that will contain all of the patient's important anatomical, physiological, and genetic information. This simplifies the doctor's therapy decisions, as modern examination methods always produce extensive amounts of data that are barely comprehensible. We want to visualize the digital patient model properly and provide interaction so that the doctor can get an overview of all the information about the patient and their illness at all times, as well as see connections between the different information. In addition, we are developing decision support systems for doctors, which can be based on the digital patient model and can calculate patient-specific prognoses, for example in the tumor board, and propose therapy decisions. The Life Support Systems Research Group is working on new technologies for intensive care and emergency medicine. In particular, physicians and engineers are exploring non-invasive methods of controlling lung damage. In our working group, Life Support Systems, we are at the moment focusing on developing a process called electrical impedance tomography. This is a non-invasive method of presenting lung function that is already available in individual clinical applications. Through partnership and support from medium-sized companies, we are trying to develop this into a system that can be used in emergency medicine and rescue medicine, which allows emergency physicians to assess the lung function of patients at the scene of an accident. The team is developing a mobile diagnostic system that can quickly measure respiratory rates and assess their condition, even in the case of accident victims who are trapped. If surgery is necessary, imaging methods could be used in the future. ICCAS director Andreas Melzer and his team want to develop computer-controlled ultrasound therapy using magnetic resonance imaging. This can even treat tumors. The ultrasound is very strongly focused, heat is generated, and the tumor tissue is shrunk. In the research project SonoRay, a joint project between ICCAS and the National Center for Radiation Research in Oncology, OncoRay Dresden, biologists are working closely with computer scientists and engineers. They are investigating the effects of a therapy which combines focused ultrasound and radiotherapy on the cancer cell model. The current objectives of ICCAS: workflow development in computer-assisted surgery, model-based therapy, digital patient model, all of which complement each other perfectly as a prerequisite for image-guided therapy. In this way, the imaging methods can be applied directly to operative techniques, and not only for diagnosis. And that brings full circle the range of what ICCAS has done so far, and what it may develop in the future. Intelligent technologies for better therapies and more security for both doctor and patient. That's what the scientists at the Leipzig Innovation Center Computer Assisted Surgery are working on, today and in the future.